Welcome to KEMP, Dr. Taylor, and thank you very much for taking time out of your busy day to come and talk to us about our new service, KEMP for Carers. And we're so delighted that you are going to endorse our new service, which starts very soon. And
well, thank you very much for asking me. I'm delighted to come.
Thank you. And I'd just like to ask you a few questions if you don't mind.
Certainly.
Okay then. As a doctor, how important is it that there are charities like KEMP that you can refer people to?
It's extremely important, and it's getting more and more so. I don't know if you've been to see a GP recently, but my wife went just earlier on today and was appalled that there's a notice up there saying you can only take one symptom for a 10-minute appointment. If you want to take more than one symptom, you have to book another appointment. I mean, that is quite contradictory to everything the health service has ever been about. It's meant to be free at the point of delivery as needed, and that's why we need KEMP, which is free at the point of delivery. There's no limitation on the illnesses that you look after. You look after people not only with cancer but with other life-threatening illnesses, and you not only look after the sufferer, the patient, you look after the carer tremendously. And this is why KEMP for Carers is so absolutely crucial, because the life of a carer can be terribly lonely and terribly hard. And when you think of it, it's not just 24 hours a day, it's 24 hours a day, 7 days a week.
That's right.
Well, how do you get time off unless there's somewhere like KEMP which is going to try and look after you? So it's crucial.
Thank you. And I think you've probably answered some of this question, but I'm going to ask you
Yeah,
again
don't worry. I'm sorry if I went on too long.
No, you didn't, not at all. Why is free of charge care within the community so important?
We were all brought up, at least those who are my age and not much older, to know the health service was there to look after us for the whole of our life, and that we wouldn't have to pay for it. I've worked abroad a bit. I've obviously had some time in the States, and the first thing people have to think of is in the States is having enough money to look after their health. We don't have that. The NHS is the single most important part of social life in this country, and it's free. And so thank goodness KEMP is free as well for the patient.
In the Wye Forest, an area that has seen many cuts to its National Health Service, how important is it for there to be a service like KEMP for Carers, giving local carers much needed support?
It's absolutely crucial, and since we lost the hospital here to all intents and purposes, it's become far more important. And just to be able to walk in here, it's centrally placed for the local community. Transport links are reasonably good to get here if you haven't got a car. So yeah, it's absolutely crucial that we've got it, particularly for people with the long-term illnesses. And I'm so glad that it isn't limited to just malignant disease now.
And that's true. I mean, we probably have more patients coming here with non-cancer diagnoses than we have with cancer, which is fantastic.
Yeah.
Things like heart failure, respiratory disease.
And I've looked on your list, and the very important one is motor neurone disease.
That's right. We have a high prevalence of motor neurone disease in the Wye Forest, and we have had quite a few patients who we've supported along with their carers as well through that awful journey, really.
Yeah, it's a terrible, terrible illness, and I'm not aware of any developments on the treatment side of it yet.
No.
So it's awful.
Thank you. And what do you think life is like to be a full-time carer? Obviously, we've already touched on this. You know, it can be very hard, it can be very lonely, can't it?
It's both, and as we've said, it is 24 hours a day, 7 days a week, and you don't get much time off, and you are limited from seeing other members of the family, because sometimes other members are a bit scared of coming to see somebody who's terminally ill because they don't know how to talk to them and they don't know what to say, and so you get left more and more on your own. Very difficult.
And you know, obviously this service is going to give that carer the opportunity just to maybe have a few hours where they're not having to be clock watching, you know, go and have a cup of coffee with family or friends.
It's absolutely crucial. They can get out and get away from their problems and do a bit of shopping, which probably they can't normally do.
Yes, that's
so
right.
it's absolutely vital, and I'm delighted